Hi, this video is designed to help someone who has hyperacusis, which is also called sound sensitivity. It's unfortunate that sometimes in life, the human body and brain develops hypersensitivity to external sounds. Sound sensitivity is tough because otherwise normal sounds during a period of hyperacusis or sound sensitivity can sometimes feel painful and completely jarring. For example, the sound of running water, driving a car on the highway, being in a restaurant and hearing sound in the background. For someone with hyperacusis, the brain responds with such a loud reaction that it almost feels like someone is around bombs or a gunshot or extremely loud noise like a chainsaw, but in reality, that's not what the physical world sounds like. But internally, the neurological reaction is so high and heightened that it's completely debilitating for some people. My name is Dr. Ben Thompson. I'm founder at Pure Tinnitus. Tinnitus is often linked with hyperacusis. This video will walk us through how to manage hyperacusis using sound therapy devices and using earplugs. Welcome to Pure Tinnitus. All right, let's talk about hyperacusis. Fortunately, I can say, after personal experience, after understanding science and reviewing many different cases, that hyperacusis, sound sensitivity, is treatable for many patients. From a medical definition, there is a cure in the sense that it gets better and it completely does not come back. So that does happen. And I just wanted to make that clear for those who have sound sensitivity, for those who have hyperacusis, there is hope. There's two main considerations here when you're managing hyperacusis. Number one is that when you're in quiet places, for example, in your own home where there's no sound around you, you need to use sound therapy. Use constant sound therapy like a white noise machine, ear level sound generators, potentially hearing aids that have sound therapy features, sounds from your phone, fan, or anything around you that's providing sound. It does not need to be so loud. We don't need to push ourselves with the loudness, but we want constant low-level sound around us, especially for the acute periods of once you've developed sudden hyperacusis. For those next months to come, it's very important, very vital that you have constant low-level sound therapy around you when you're in quiet places. The impact of this is increasing the noise floor. If you're in a quiet place, it's very, very soft. The noise floor is very low. So if we're increasing the noise floor, that has positive neurological effects that can help bring you back to a place where sounds are not as sensitive. I work with tinnitus patients every day, and other than hearing loss, the most common accompanying symptom with tinnitus is sound sensitivity or hyperacusis. So what would you do if you have hyperacusis, but you need to go drive and then go to the grocery store and then meet your friend at the restaurant? All of those situations are potentially too loud and triggering for you. So how do you manage that? Do you stay at home? Do you try to go? Do you put earplugs in your ears? The answer is we have a way to use earplugs to help us in those situations so that you can still drive in a car, hear the highway, the road noise, you can go to a grocery store, and you can meet up with friends, meet up with family, and be in a restaurant where there's background noise. The thing is, we have to get very crafty about controlling what's coming in through our ears. There's a range of noise reduction on different earplugs. On this side, we have the most noise reduction. This would be over-the-ear earmuffs, foam earplugs, and things that are designed to reduce as much noise as possible. On the other complete end of that spectrum, we have your ears completely open where there's no noise reduction at all. And depending how severe your hyperacusis is, we're going to slowly wean yourself towards being able to tolerate those situations without anything in your ears. I have a patient who can only drive on the highway when they have over-the-ear headphones, and that's reducing as much noise as possible. Now, that patient and I are working overtime to start taking those headphones off and use foam earplugs in their ears when they're driving on the highway, because the foam earplugs are not as strong of a reduction as the over-ear headphones. So we're going to work slowly towards weaning them towards being able to drive in their car on the highway without anything in their ears. It does take time, but that's the trend that we'll use. So whatever situation my patient has trouble with, we're going to understand what can we do to help and where are they on this spectrum. If someone can tolerate wearing foam earplugs, then the next step towards nothing in the ears and towards less hyperacusis would be reusable silicone plugs. These are often called musician earplugs or reusable silicone rubber earplugs that you would bring to a concert. Those have less noise reduction than the over-ear headphones and the foam earplugs. That means they let more sound in. So you can see here we're getting closer to being able to be in that situation, like driving a car on the highway or being in a restaurant without anything in your ears. And it does take time to get there, but trust me, it happens. Now, traditionally, those silicone musician type earplugs, they reduce about 10 to 15 decibels. And then the next jump would be having nothing in your ears. With those silicone earplugs, you can remove them slightly out of your ears, and that does get you closer towards this end of the spectrum here. But traditionally, there hasn't been something that's less than around 10 decibels, we'll say, or only affecting the high frequencies that you can put into your ear, and then that gets you closer towards being able to tolerate having nothing in your ears. Now, in recent times, there is a product that's developed that is hollow, that sits in the ear canal, that only affects the high frequencies. It only reduces high frequencies, and it can be used as a buffer in between those reusable silicone earplugs and having nothing in your ears. And that device is called the Flare Calmer. We'll show it on the screen here, how the Flare Calmer looks. It's not designed for tinnitus, but it does have a lot of benefit here for this use case of hyperacusis, managing sound sensitivity. Let's say you were in a restaurant and the silicone reusable plugs were working, but you were still having trouble hearing people around you, and you wanted something in between the silicone reusable plugs and having nothing in your ears. Then the Flare Calmer has a unique product fit in this market to be able to help manage the hyperacusis. So part of this whole spectrum is understanding where you are, because once we understand where you are, then we work professional to patient. We can work on bringing you closer and closer to having nothing in your ears or very little in your ears to reduce incoming sound. Thank you for watching how I manage hyperacusis in places with loud noises by using different degree strength of earplugs. It was fun to guide you through this process. The premier treatment of hyperacusis is tinnitus retraining therapy. And that typically means working one-on-one with a professional like myself. Hyperacusis is well designed for telehealth. Feel free to reach out to us at puretinnitus.com if you have any questions about our services. And thank you again for watching this video. My name is Dr. Ben Thompson. Pleasure to show you how to live better with hyperacusis. And leave a comment if you have any questions. Our team will get back to you very shortly. A final ad here is that tinnitus retraining therapy involves one-on-one counseling in a sustained manner for hyperacusis and potentially tinnitus as well, and consultation and guidance about how to use constant sound therapy, the different technology you have. What's very interesting in this field that we live in is that tinnitus work, hyperacusis work, it's the intersection of technology and psychology, how the brain and technology come together to help these symptoms long term. Watch this next video on my site here to learn more about tinnitus retraining therapy. Reach out to us at Pure Tinnitus if you have any questions, and thanks so much.